Substance abuse has largely contributed to cases of mental health in the country. According to the Ministry of Health, Nursing Officer Gabriel Lungu disclosed that the large proportion of cases at Chainama Hospital in men's wards are substance abuse related. And the substance abuse rehabilitation therapist and educator, Dr. Lakson Banda, has called on government to look at modalities on how some substances can be properly regulated.
Of young people right now that are in the streets, that are drinking cachasu, that are drinking junta, that are drinking these alcohols which are even not properly regulated. The number is high, and I believe that this is posing a very serious economic threat. It's posing a very serious mental health challenge to our nation, Zambia. Because if this will not be corrected, we have a generation to lose. And that generation, it will be posterity that will judge the community, that will judge the church, that will judge the government and other civil society organizations involved in the welfare of people if we do not take an action collectively to combat and end the abuse of alcohol. It is very shocking that when you wake up in the morning and pass through the streets of Lusaka and even some other compounds right here in the Republic of Zambia, that you find young men who are supposed to be productive early at a tavern, early at a brothel, early at some place of drinking, some even in the streets drinking cachaso, drinking junta, which is a very unfortunate situation that our nation Zambia finds itself in.
Gabriel Lungu says substance abuse amongst youths derails the economic growth and social development of the country.
As I said, once someone becomes mentally disturbed, becomes a liability, meaning that you only spend on them without them contributing to the development of the economy. So what we would wish is to have a substance-free, a mentally healthy generation that is able to work and contribute to the well-being and development of the economy. History has it that our first president, Dr. Kenneth Kaunda, threatened to resign because he wasn't ready to lead a nation full of drunkards. He wanted people who were ready to work and contribute to the development and growth of the economy.
Meanwhile, Lusaka City Council, through its public relations manager, George Sichimba, warns against the illegal sale of alcohol in streets.
Is that alcohol is quite sensitive, not just in terms of poisoning, and so it's not a commodity that should be sold anyhow. Some people are selling even in the streets. That is not correct. Those that are doing so should stop forthwith. But this problem is also a two-way thing. Those that are consuming the same alcohol, why should you go into the street and buy alcohol? You don't know the source. You don't know how safe that alcohol is. People should.
However, Dr. Banda appeals to government to compel liquor producers to set up a fund under the social corporate responsibility that will help organizations in rehabilitation of youths who get addicted on their products.
And the government also should look seriously into formulating a law, and that law that will compel the liquor producers in this country to make sure that deliberately and intentionally there is a policy that compels them to respond to the side effects of the products which they are making. For example, alcohol. Let's talk about junta. These are the flames that our country is seated on a flame. It's a time bomb. So if government compels these people, these liquor producers, to create a fund that will help organizations dealing in rehabilitation to make sure that they do their job properly.
Joseph Tamad Banda, QTV News, Lusaka.